I'm delighted to present you with one of the results of my research entitled Variables Associated with Having Uncontrolled Hypertension Among Patients Receiving Primary Health Care Services in Marrakech, Morocco, presented by Elhassania Khalloufi. During this presentation, we will adapt the following plan, starting with a general introduction throughout which we will define our research theme and outline our work objectives before moving on to our experimental study, followed by the research of these works, and ending with a conclusion and outlook. As you know, hypertension or elevated blood pressure is characterized by a clinical basis as systolic blood pressure of is greater than or equal to 140 millimeters of mercury, and or diastolic blood pressure is greater than or equal to 19 nits millimeters of mercury. Worldwide, its HBP affects more than 30% of the world's population. It's also considered one of the leading causes of mortality and morbidity, 10.4 4 million deaths per year. However, despite the availability of effective and affordable drug treatment, the global disease control rate remains low, with only 13.8% of cases. Uncontrolled hypertension is therefore recognized as the main risk factor worldwide, responsible for 19% of deaths. And Arab Maghreb, 64.3% hypertensive patients under treatment had uncontrolled hypertension. In Morocco, there was a very high rate of uncontrolled hypertension in hypertensive adults, ranges from 73% to 82.9%. Uncontrolled hypertension carries an increased risk of mortality, particularly from cardiovascular disease and cerebrovascular disease. This risk factor is complex public health problem that depends on several factors. Predictive factors like age, education level, low income, abdominal obesity, comorbidities, patients' lack of knowledge, obesity, a family history of hypertension, no adherence to medication. Also, all these factors were predictive factors of controlled hypertension. In Morocco, few published studies have focused on assessing the predictors of uncontrolled hypertension in the hypertensive population. So this well, thus comes the origin of this study, which aimed to determine the predictive factors of uncontrolled hypertension in hypertensive patients followed in primary health care facilities in Marrakech, Morocco. We will now move on to our experimental study in which we will adopt the following experiment protocol. We started with the study was cross-sectionally surgery conducted in health centers in the medical prefecture of the city of Marrakech. We collected the data from January 23 2024 to February 29, 2024. The study involved 319 hypertensive patients followed up at primary health centers. In this research, we chose to use inclusion criteria such as hypertensive patients of about sexes aged 18 years and older, followed up at the PHC level. Also, we have adopted the following exclusion criteria, like pregnant women, um, individuals with physical disabilities and mental disorders, individuals who refuse to participate in the survey. We collected data via questionnaire in the Moroccan Arabic dialect. The toll consisted of 5 parts: sociodemographic variables, disease information, anthropometric parameters, the hypertension evaluation of lifestyles and management knowledge skill, lifestyles variables in the 18 habits. In this study, we used SS version 22 software for data entry and analysis. We analyzed qualitative variables by frequencies and percentages, and quantitative variables by means and standard deviation. Also, we use the chi-square test for categorical variables when appropriate. Also, main whitening U test for numerical variables. We also performed the bivariate and the multivariate analysis to examine significant association between variables and uncontrolled hypertension. A p-value at least than 0.05 was considered statistically significant. Uh, Data collection was initiated after approval was obtained from the University Hospital Ethic Committee of Marrakesh. Was also obtained administrative authorization from the Regional Health Directorate of Marrakesh, Safi, for patients' access. Our results are as and this table we say that female gender predominant with 230, 72.1%, and the mean age of the participants was 56.44 with a proportion of 127 with 39.8% for the 50 to 60 years age group. Married respondents were two 208 with 65.2%. Illiterate people represent 204, 63.9% of the participate. Okay, and 174 of declared financial anatomy. Okay. In this table, we see the result of clinical characteristics of participate with 200 participants with 62.7 reported a family history of hypertension. Okay, and 164 with 54.5% had comorbidities, of which diabetes and dyslipidemia represented 130 with 40.75% and 72 with 22.6% cases respectively. Regarding now the duration of treatment. We have 53 with 16.61% of the survivors followed their treatment for a period of less than equal to 2 years. While 145 with 45.45% continued it for more than 5 years. Also, we have 231 with 72.4% of the surveys had abdominal obesity. Here we see the mean of systolic blood pressure and diastolic blood pressure were 147.80 millimeters of mercury and 82.56 millimeter of mercury respectively. Those 241 participants had uncontrolled hypertension, indicated a prevalence with of 75.5. The results indicate that 3/4 of persons have uncontrolled blood pressure. This rate remained relatively high as they did not exceed 70% in primary care patients in other contexts. The highest proportion was reported in an Indonesian study with 68.1%. Participate with the dyslipidemia had 3.564 times higher risk of uncontrolled hypertension compared with other participants. Dyspnea has also been identified as a predictor of poor hypertension control. The same finding has been made in the other studies. Also, respondents who didn't not adhere to medication were 0.111 times more likely to have uncontrolled hypertension than those who adhere to the medication. Okay, no adherence to the treatments. Here we see that it was predictive of uncontrolled hypertension. The same result was found in other studies. This finding could be due to the shortage in stocks of anti-hypertensive drugs at the PHCF. Financial access to drugs linked to the insufficient source of income of patients and the lack of education of the disease. This study aimed to evaluate predictive factors of uncontrolled hypertension. All these results revealed that most hypertensive patients followed in primary healthcare facilities in Morocco had higher rates of uncontrolled hypertension. According to our study, several factors have an impact on the uncontrolled hypertension. Okay. To improve predictive factors of uncontrolled hypertension, it's crucial to encourage primary care health professionals to stimulate therapeutic educational activities. Integrating educational means adapted to the characteristics of the hypertensive population.